Well, good morning, everyone. My name is Anand Parikh. I'm the Chief Medical Advisor at the Bipartisan Policy Center. I want to welcome all of you to the National Press Club this morning for our event entitled Good Health is Good Business. For those of you who are new to BPC, our mission is to actively seek to combine the best ideas from both political parties to promote health, security, and opportunity for all Americans. BPC's health program strives to develop policies and support efforts which improve the nation's health outcomes and reduce preventable healthcare costs. Many sectors have a shared responsibility and role in this regard, and thus cross-sectoral and public-private partnerships are crucial to optimizing health. Two of these sectors are public health and businesses. BPC believes that a robust public health infrastructure is critical to disease prevention and health promotion. BPC has also recognized the role that businesses can play in promoting health and wellness, well back to 2014 when it launched its CEO Council on Health Innovation to improve for business leaders to share best practices and make commitments to improve health as well as health care. Today's report makes the case that these two sectors, governmental public health and businesses, should work together to improve community health. It lays out the value proposition for both sectors, addressing questions such as why haven't these two sectors worked together as much in the past, and why should they increasingly work together in the future? The answers, in short, are that these two sectors have unique, aligned, and synergistic attributes, which, if combined, can have a significant impact on health. For example, public health can offer businesses credibility and expertise in community health promotion, data analysis and evaluation capabilities, relationships with community organizations, training and technical assistance capabilities, and an understanding of how to engage with the health delivery system. These services benefit businesses by creating a healthier workforce pool, attracting and retaining top workforce talent, enhancing employee morale, potentially reducing direct and indirect costs, enhancing the corporate image, and improving community relations. Likewise, businesses can offer public health agencies many things as well: a reach into the community through their employees and families, expertise in marketing, communications, and public relations, and resources and capacity to contribute funding, staff time, services, and products. These services benefit public health through improved community health, renewed interest and investment in governmental public health agencies and initiatives, and greater awareness and buy-in from policymakers and other influencers. Today's report makes note that the most robust partnerships between governmental public health agencies and businesses require motivated and committed leaders, equal and complementary participation, and joint strategic planning to establish common ground. While there may be barriers to engagement, including language and communication, conflicts of interest, lack of resources, staff turnover, and culture, there are many opportunities to inform successful public-private partnerships, as you'll hear more about today. The report concludes by offering recommendations to governmental public health agencies and individual businesses and chambers of commerce at the local level. These include recommendations such as focusing on common problems, preparing an ask, recruiting leaders as initiative champions, and measuring success and impact. There are also recommendations to regional, state, and national organizations such as philanthropies and government to promote business public health collaborations by distributing new and compelling case studies, establishing recognition programs, and funding new demonstration programs. The aim of today's report can be boiled down to one word: catalyze. That's the word of the day. We want to catalyze a movement across the country so that in every community, in red areas as well as in blue areas, we have established partnerships between governmental public health agencies as well as businesses geared towards improving the health of the population. Today's report should be seen as a tool to both sectors so they can understand the value proposition in front of them and familiarize themselves with the elevator pitch, if you will, to engage in these partnerships. At this time, I'd like to take a moment to acknowledge and give thanks to our partners who have helped us to get to where we are today. First off, thank you to the Beaumont Foundation and the Robert Wood Johnson Foundation for their contributions and support to this effort. Both of these foundations are leading forces in promoting public health and specifically in engaging businesses to promote health and wellness. Second, I'd like to recognize Dr. Ron Getzel and his excellent team at the Johns Hopkins Bloomberg School of Public Health for being our technical consultants on this report. Thank you for your expertise as well as your dedication to this work. Third, I'd like to recognize both the National Association of County and City Health Officials, NACCHO, and the U.S. Chamber of Commerce Foundation for their help in identifying communities that are leading this work at the local level. The report features case studies of several communities. One example that you'll hear more about today involved the Kansas City Chamber, which collaborated with the Kansas City Health Department and other partners to tackle several upstream drivers of health, including a multi-year effort to get municipalities to raise the tobacco sales age from 18 to 21. And finally, I want to thank our advisors on this project. 4 former Health and Human Services Assistant Secretaries of Health across multiple administrations, all of whom I had the honor of working with over the course of my decade in public service, provided their guidance and expertise throughout this project. Though they're not able to join us today, I'd like to formally recognize Dr. John Aguinobi, Dr. Karen DeSalvo, Dr. Howard Coe, and Dr. Joxel Garcia. So with that, let's go ahead and get started. We have an extraordinary set of speakers who have joined us today for the report launch. I'd like to first introduce the president and CEO of the Beaumont Foundation, Dr. Bryan Kest, to provide some opening remarks. Bryan came to Beaumont after 10 years serving in governmental public health agencies. Under his leadership, Beaumont has created pioneer investments to improve community health, such as the Public Health Workforce Interest and Needs Survey, the Practical Playbook, City Health, and the Build Health Challenge. Bryan has become a national leader on the topics of public health policy and community health, and so please join me in welcoming him to the stage. Bryan?
Thank you, Anand. Good morning, everybody. I'm glad that we could give you all something to do while you're waiting for today's 3 o'clock World Cup game. So this will help us pass the time and get the game here even sooner. So at the Beaumont Foundation, we advance the policies, the people, and the partnerships necessary to create healthy communities where every person has the chance to achieve their best health and live their optimal life. Our founder, Pete de Beaumont, was a business person. He founded the Brookstone Company, and he did that in 1965 with just $500 and sold the company in 1980. Unfortunately, he used the proceeds to found the Beaumont Foundation, and the staff and I are very grateful for that. Today, the foundation continues to value the role of business in improving the health of communities and people, and it's a real privilege to be launching this report with the Bipartisan Policy Center. What we're hopeful is that this isn't going to be the typical report about business and health, right? All too often, we talk about business and health, and the conversation centers around employee wellness programs. But when those are really implemented appropriately, employee wellness programs can make a real difference. It's just that their benefits are often too limited. These programs have focused on modifying health behaviors like smoking and poor dietary choices, and encouraging screenings. But what we know now is that individual health choices only account for about 30% of our health outcomes, while our physical environment, along with our social and economic factors, can account for half. And given the existing focus of employee wellness programs, they alone cannot get us to the health solutions that we need for health issues that originate in the community and over which no one individual has control. The funds invested in individual employees are often less effective when that employee's community is antagonistic to good health and well-being. There's one Fortune 50 company that reviewed their healthcare spending and found that 80% of employer healthcare costs were actually spouses, children, and former employees. So in this case, the employee wellness program was only impacting those who were accounting for about 20% of the employer's healthcare costs. To impact the metrics important to the business sector, like reducing healthcare costs, decreasing absenteeism, and increasing presenteeism, we need to go beyond the traditional employee wellness programs. The next frontier in employee wellness moves beyond the walls of any one business to focus on community health. And we're actually not alone in recognizing this. In his 2018 letter to CEOs, BlackRock CEO Larry Fink outlined his expectations that companies begin to account for their effect on society, commenting that the public is demanding that companies serve a social purpose. His words were further supported by a 2017 Cone Communications survey that found 7 out of every 10 Americans believe that companies have an obligation to take actions to improve issues that may not be relevant to their particular business line. We envision a world in which business and public health agencies understand that their most pressing challenges are shared. We could make so much progress if both sectors start with the goal of creating communities where every person has the chance to achieve their best health and live their optimal life. Now, I could rattle off studies and statistics. I'm an epidemiologist, so they train us to do that in school. But I actually want to tell a story and focus on the people that we're actually talking about. So, somewhere in America this morning, there is a hardworking, dedicated employee who makes good choices and watches his diet and exercises and takes full advantage of the employee wellness program, but he is not at work. His daughter's at the pediatrician. They're following up from last night's visit to the emergency department due to her asthma, and it's not the first time. This same scene has repeated itself on an endless loop since he moved their family to their new apartment. Now, he's diligent about his daughter's care, but of course his efforts and those of his daughter's pediatrician are in vain. What's triggering her asthma is the mold in the apartment. And despite his repeated complaints, the owner of his property has done little to help. So in this story, the employee's business bears a cost along with the family. Absenteeism increases, healthcare costs escalate, and this employee becomes less productive at his work as he worries about his daughter's health. And this is only one example of one employee's family with one disease. This story plays out across America, across multiple families in different communities and different businesses across our country. If it's not asthma, then it's obesity or diabetes or mental health or community safety, but the solution is the same. It's about creating communities where policies are in place that support everyone's health. In this example I shared, the solution is rental inspection policy that holds the property owner accountable for the quality of their rental properties. Impacting employee health requires us to move beyond the walls of our businesses, to shape the communities in which our employees and our consumers live. Partnerships between public health and the private sector are the future of good business and good health in our communities. With today's report, we hope to elevate this conversation, push the evolution of employee wellness, and encourage partnerships between state and local public health agencies and businesses. Because each want their communities to thrive. They want their economies to thrive. They want our nation to thrive. But all of that is predicated on creating communities where people can be healthy, engaged, and vibrant. So building on this theme of good health is good business, we couldn't have a more appropriate speaker than the nation's 20th Surgeon General, Dr. Jerome Adams. Throughout his time as Surgeon General, Dr. Adams has been a powerful national voice on the importance of multi-sector partnerships with a mantra of better health through better partnerships. As Surgeon General, Dr. Adams holds the rank of Vice Admiral in the U.S. Public Health Service Commission Corps and oversees the operations of approximately 6,500 uniformed health officers who promote, protect, and advance the health and safety of our nation. Dr. Adams is also also served as the Health Commissioner of Indiana. It is my distinct pleasure to introduce Dr. Jerome Adams.
Well, good morning, everyone. Good morning. You can do a little bit better than that. Good morning, everyone. Good morning. It's a good day. It's a great day. Thank you, Bryan, for that kind introduction. And thank you, Bryan, for sharing my story. You all didn't realize that Bryan was actually telling my story. I was that kid with asthma whose parents missed work to take me back and forth to the hospital over and over and over again. I stand before you not just as the nation's doctor, but as the nation's patient, someone who has seen this play out, unfortunately, to the detriment of me, to my family, but also to the detriment of the community. And I also want to give a special nod to my good friend, Mayor Betsy Price. She's taken the lead to bring Blue Zones to Fort Worth, Texas. And I had the opportunity to visit them in Fort Worth last year and see all the wonderful work they've done to engage businesses and community leaders to invest in health. And that's part of what today is about. It's about hearing best practices, learning about the toolkit that's available for different communities to be able to invest in health. I'm delighted to join this Bipartisan Policy Center event to release the new report, Good Health is Good Business. And it's critically important. What Bryan didn't tell you is I've got an MD, I've got an MPH, but my most important credential is DAD. I've got a 15, a 13, and a 9-year-old, and I stand before you as the first generation of parents in the last half century who can't look their kids in the eye and say, you're going to live a longer life than what I'm going to live. We know that for the third year in a row, life expectancy is declining due to deaths of despair, due to alcoholism, due to suicide, due to opioid misuse, which is really accelerating the conversation that we're having right now, due to obesity. And we know we can't address these societal problems alone. We know that the private sector has a large role to play because they have a stake in their communities, and they're bearing a large part of the cost of poor health. So thank you to the Bipartisan Policy Center and the Beaumont Foundation for highlighting this report and providing action steps on how businesses and public health can work together. This report, along with my Community Health and Economic Prosperity Initiative, will make great strides in improving the health of our nation. So I want to back up a little bit. I'm a Vice Admiral in the United States Public Health Service Commission Corps, 6,500 full-time public health professionals committed to advancing, promoting the health and safety of our nation. But the most visible role of the Surgeon General is to communicate the science around health to the American people. And in that role, I'm focused on promoting health, preventing disease, and leading with the science to help all Americans live the healthiest lives they can. But I'll tell you, even though I'm committed to leading with the science, I want you all to remember something that I say often to folks, something that I said to the new doctors. It's that time of year when we've got new residents graduating and going off to practice alone, and we've got new interns coming in, that all the science in the world doesn't matter if people don't think you care about them. People need to know that you care before they care what you know. And where my work intersects with all of you all is around the topic of improving the health of communities by making the connection between investments in communities and associated economic prosperity. And I want to tell you a quick story. You know, it's easy for me to talk about the successes I've had. I want to talk about one of my biggest failures. When I was head of the Indiana State Department of Health, we had a conversation about whether or not we should raise our tobacco taxes because we had still have some of the lowest tobacco taxes in the country. And the science says that when you raise the cost of tobacco, fewer people smoke. Well, we were in front of the legislature and had 2 hours of testimony from the experts, the choir, telling us quite frankly what we already knew. Tobacco's bad for you, and if it costs more or less, people smoke. At the end, we had about 15 minutes of testimony from the business community. And I say business community, the mom and pop bars, the gas stations, and the casinos. And they didn't refute anything that we said as health experts. But they said, you know, if you do that, people are just going to go across the border to Ohio and buy their cigarettes, and we're going to lose jobs. It's going to be bad for business if we actually raise the tobacco taxes in our state. And, you know, I reflect on that often. I ask myself, if I had to do that all over again, how should I try to change the outcome? Is it by bringing more health experts to the table? I'd contend no. We need to help other businesses, larger businesses, the real business community, understand the importance of them showing up when these important policy debates are going on, because we know the number one cost for most Fortune 500 companies is salary, number two cost is healthcare, and the biggest, the most evidence-based way to lower that healthcare cost is to prevent people from smoking or to help people quit smoking. Good health means good business. We know communities shape health, and health is essential to prosperity, and it's a virtuous cycle. It can be a virtuous cycle. In far too many communities, the cycle goes the other way. We don't invest in health, business suffers, health suffers, and you have a downward spiral. But we've seen in communities like Fort Worth, Texas, like East Lake, Georgia, that we can create that virtuous upward cycle. Business and public health, the two sectors the report you're going to hear about today focuses on, need to be interested in both, because you can't have one without the other. You cannot have one without the other. And you heard my guiding principle is better health through better partnerships, because none of us can do it alone. And when the solutions are complex, when they're innovative, when they're new, and especially when they're controversial, we can't afford to keep operating in silos. So my community health or economic prosperity, or CHEP initiative, as I like to call it, is the concept that community health and economic prosperity are inextricably linked. Again, you can't have one without the other. And I want to quickly recognize Dr. Ursula Bauer, who we stole from CDC. She was the head of the CDC Chronic Disease Center, and I said I absolutely have to have her to come work on this report. And I want you all to know who she is, because she's going to be a conduit with our office to help us lift up this CHEP report. She knows, as many of you all know, that our health outcomes are in large part determined by our circumstances. Put another way, your zip code is more important than your genetic code in determining your ultimate health outcomes. Environmental, social, economic, physical factors shape the opportunities we have and the behaviors that we adopt. I 100% believe in personal responsibility, but I also 100% believe that the choices you make are completely dependent on the choices that lay in front of you. I'm a doctor. I live in a nice neighborhood. I can tell my kids to go out and play. I can walk a half a mile down the street to the grocery store and get fresh fruits and vegetables. I have the opportunity to make that healthy choice. But just outside the door right here, there are far too many folks who don't have that opportunity. How far do they have to go to get to the nearest grocery store? Can they send their kids out to play and exercise without fear of them being hit by a car or accosted by someone who has nefarious intentions? Right now, so much is at risk because many of our communities and their residents aren't as healthy as they could be. We aren't putting them in the position to make healthy choices. And it's more than just our future prosperity that's at risk. It also impacts our national security. I've been working with the Surgeons General of the Army, the Navy, and the Air Force because, shocking statistic, right now 7 out of 10 of our 18 to 24-year-olds in this country are ineligible for military service because they can't pass the physical, can't meet the educational requirements, or have a criminal background record. Put another way, our nation's poor health isn't just a matter of chronic disease, the things that Dr. Bauer cares about 20, 30 years down the road. We are literally a less safe country right now because we're an unhealthy country. The bottom line, we must do better. When we make the case for community health as a pathway to economic prosperity, we then foster the investment in our communities that not only improves population health, but raises and sustains our collective financial success and our national and local security. So I want to highlight 3 things that I want you to remember and that you should take from the comments that people are making today. Number 1, U.S. healthcare is expensive. We spend $3.4 trillion with a T dollars on healthcare each year. Almost $1 in $5 our economy generates now goes to pay for healthcare. And the private sector pays for a good chunk of that. It's hurting our economic competitiveness across the world. I was talking to a gentleman who's one of the GM execs. He actually challenged me when I said the number 2 cost for Fortune 500 companies is healthcare. He said, no, for us, our number 1 cost is healthcare. You're paying more for healthcare than you're paying for any other component when you buy a General Motors car, and yet we wonder why our American companies are struggling to be competitive with other entities across the planet. And these dollars aren't just diverted away from company profits, but from critical funding priorities like job creation, wage increases, and research and development. We fight about a mandatory minimum wage. Well, one of the biggest challenges for companies in terms of doing the right thing is that instead of being able to take their profits and divert them to wage increases, they're taking them and diverting them to pay for higher and higher healthcare costs. So if you want a higher wage in your communities, you need to address healthcare costs. Healthcare expenses also drain what we call the common resource pool, limiting funds available for infrastructure, education, public safety, and other national and local priorities. So even if you don't care 1 iota about health, if your top priority is crumbling bridges, if your top priority is a free college for everyone, then you need to make sure you're investing in healthcare because that money that would go to pay for those other things is being sucked away from those other priorities because of healthcare costs. In short, we all pay for lower health status one way or the other, and we all pay for higher healthcare costs. And it's not just healthcare costs that are a drag on our economy. It also affects, as Bryan pointed out, our productivity. Workers with chronic pain account for $11 to $13 billion in lost productivity annually. Full-time workers in the U.S. who are overweight or obese or have other chronic health problems miss 450 million more days of work than healthy workers. This amounts to more than $150 billion a year in lost productivity. How many people's college tuitions could we pay for with that? How many bridges could we pay for with that? And that's not the end of it. Our poor health leads to a total annual productivity loss of $226 billion, a drag on our businesses and our economy. Second thing I want you to remember is we're not getting what we pay for. On measure after, we're spending all this money, what's our ROI? On measure after measure, life expectancy, infant mortality, maternal mortality, obesity, we fall far short of other nations despite spending so much money. So how can it be that we spend so much and get so little in return? Well, again, as Bryan pointed out, health care is a very small part of overall health. So a lot of the focus, even in the debates you heard last night, were on health care, health care, health care. And I stand before you as the nation's doctor not to say that health care and access to high-quality, affordable health care is not important, but to help you all understand that if we focus 90% of our time, our talent, and our treasure on 10% of the problem, we're not going to move the needle. 80 to 85% of health is driven by factors that have little to do with health care, factors that largely exist in our communities. We know that most health occurs outside the four walls of a clinic or a hospital. Things like good-paying jobs and the skills to get and to keep and succeed in those jobs, what the Department of Labor calls family-sustaining careers, quality housing, transportation, access to places to be physically active and healthy, affordable foods, tobacco-free communities, and strong and supportive social networks. These community features shape health behaviors and influence our nation's health far more than access to health care. The report that's being released today, Good Health is Good Business, understands these fundamental relationships. And here's how the dots connect. Start with those family-sustaining careers. Add in a dose of housing and education, quality childcare, access to safe places for kids to play and be physically active, and to nutritious foods that people know how to cook and prepare. And what you get is healthy people. And when you have those healthy people who are physically, socially, and economically healthy, they in turn become healthy, productive, present employees. They become consumers who have more money to spend and less likely to need expensive downstream social supports, less likely to become incarcerated, like my brother right now, who instead of contributing to the economy, is costing each one of you all as taxpayers about $100,000 a year to keep him incarcerated due to his unrecognized, untreated mental health issues, which led to substance abuse and addiction. Multiply that positive effect across communities, businesses, and employers, and what you end up with is a robust economy. Multiply what's going on in far too many communities, what's going on to my brother across the United States, and what you see is a drag on our economy. It all starts with investments in community health. Now, some people think it's the government's job to invest in our communities, but in a democratic market economy like ours, it's everyone's responsibility. Everyone is a stakeholder. So I want to close with a call to action to you all. As leaders in public health and in business, you have unique opportunities to leverage your influence and resources to forge stronger partnerships that promote the health and economic prosperity of your communities. Do this by identifying and addressing the barriers to good health in your communities. Business and civic leaders, faith organizations, justice and law enforcement, philanthropies, finance, you all have a role. And let me say to my public health friends in the room, we often think people should come to our table and learn our languages and help us solve our problems. But that's not the way it works. We have to build better partnerships by going to non-health partners, identifying, listening, and often doing things their way. We get more done when we build that trust, solve the problems that matter to others, and in the process, we see that they'll be more willing to engage and help us solve our problems. I call on you to help strengthen worksite wellness programs, addressing factors like tobacco, healthy food, and physical activity, financial literacy and capability, and beyond. But as Bryan mentioned, we must go beyond worksite wellness to improve community health. For business leaders, remember 80% plus of health is beyond health care. Lean into those factors that challenge health. Support efforts to improve housing, education, access to foods, transportation, and healthy child development. Many businesses and employers fail to realize the value that accrues to them from investing in communities. And again, I'm not talking just about philanthropy. I love talking to your foundation president. I need to talk to your COO and your CEO. We need it to be not just part of your philanthropic plan, but part of your overall business strategic plan. True investment means incorporating it into everything that you do so that when the economy goes down, your contributions to community health don't go down. That's when you double down on them because you know you're going to have more resilience if you do that. And that's why the report today is so important. Businesses and public health must work together to solve our nation's most pressing health problems, which are business problems too. Anand said that his key word for you today was catalyze. My key word for you today is partnerships. I invite you to join me to help create a future where communities are built so people can more easily make healthy choices and where businesses invest in those communities as a way of achieving a healthier workforce and a healthier bottom line. Thank you very much. We have time for one or two quick questions if folks have one. All right. No questions for the Surgeon General? I'll take it. All right. Thank you so much, everyone. I appreciate the opportunity.
I want to thank Dr. Adams for his inspiring remarks, and thank you so much for being here. It means a lot to all of us and for this movement going forward, so thank you. At this time, I want to introduce our second keynote speaker, Ms. Diana Farrell. Diana is the founding president and CEO of the Jpmorgan Chase Institute, where her work helps policymakers, businesses, and nonprofit leaders make more informed decisions that advance prosperity for all. Diana previously served in the White House as Deputy Director of the National Economic Council and Deputy Assistant to the President on Economic Policy. Diana has also served as the global health of the McKinsey Center for Government and the McKinsey Global Institute. Please join me in welcoming Diana to the stage.
Good morning. Thank you for having me, and thank you for your remarks. And let me thank also the Bipartisan Policy Center and the Beaumont Foundation. This is a very important report and something that is very near and dear to my heart and my company's heart, and I wear two hats there. One is as the president and CEO of the Jpmorgan Chase Institute, as you mentioned, but also as a senior leader of the largest bank in the country. And in both those regards, this is a very important discussion. Let me start with my first hat as president and CEO of the Jpmorgan Chase Institute, which is a think tank dedicated to the public good, but to delivering data-rich insights and expert analysis on really important matters. We do it in a very unique way. We mine the administrative data of the bank's own transactions in a de-identified way to help engage in a policy discussion about important matters, and healthcare is certainly on that list. Our integrated high-frequency data on the lives of households, the financial well-being of households, gives us a unique perspective to address what for most households is a critical issue. Health, of course, healthcare provision, of course, but the expense of healthcare on top of that. And one of our key findings across the financial health space for households is how vulnerable households are to unexpected situations. These could be dips in income, these could be spikes in spending, and lo and behold, healthcare rises as one of the most important ones. Even for people with healthcare insurance, when subject to high deductibles, are subject to significant out-of-pocket expenses that have significant impacts on their financial well-being as well. And so in addition to the importance of health for its own sake, good healthcare provision, the link with financial health is essential, and it's something that we care a lot about from a policy point of view, and we care a lot about from a bank point of view. In 2017, to try and add to this conversation and partner with policymakers, we developed what we characterize as HOSP, the Healthcare Out-of-Pocket Spending Panel, that has a very, very large sample, several million households, and observes out-of-pocket household spend as folks experience it. And what we see is over the course of 2014 to 2017, out-of-pocket healthcare spend for American families increased by 5.8%. Most of you know wages aren't increasing by any version of that amount. So this is a critical issue. Now, importantly, healthcare emergencies are one of the most common extraordinary spikes in spendings that people experience. And I want to underline again that this is true even for people with healthcare insurance, because the deductibles tend to be high enough to represent an extraordinary payment that can set off the financial health of households for over a year after that payment has come. 3% of families have more than one of these payments. 16% of families will see at least one of these extraordinary payments over the case at any given year. What we see is for the year post this extraordinary payment, credit card balances shoot up, financial liquid assets drop precipitously, and households are more vulnerable from a financial point of view. I want to highlight another aspect of our research is that too often, because of the dynamics I described, and too often because most Americans don't have the financial buffer to withstand these spikes in spending as they are required, people defer care. They defer going to the doctors and hospitals until they actually have cash to pay for them. And we see this very vividly in our data when you take the example of tax refunds. Tax refunds is one of the most important liquid events in a household's life in America. For most households, that's the single largest cash infusion that comes into the household. It's in fact 6 times the weekly take-home pay for most families who receive a tax refund, and that's about 80% of families. Now, we can observe very clearly that from the day the tax refund arrives, healthcare spend shoots up by 60% above a baseline. And furthermore, we can see that most of that spend is in person at doctor's offices, not delayed payment of medical bills. We have both going on, but to the extent that we have a lot of the cash constraint leading to deferred care, we know that healthcare does not age well. Seeking healthcare, the sooner the better, and we've actually had very good discussions with part of important partners, the Cleveland Clinic, many of the HMOs, who confirm that this deferred care problem is a real issue for healthcare outcomes. So overall, our research really underscores that we'll need to get the business community, the policy community, others to recognize what is a much broader problem than just health or healthcare provision, but healthcare finance and the well-being of, and financial well-being of households. Already within our bank, we have taken these findings to heart and have crystallized an opportunity to help our employees. So just in last year, in 2018, after some of this research came out, we at Jpmorgan Chase lowered the deductibles for lower income families, including the wellness programs and other programs available. That means that for those employees, they can get their deductible effectively down to zero. We think that's extremely important to ensure that people seek the care when they need it, not just when they can pay for it. So let me flip to my other hat as a senior leader of Jpmorgan Chase. This is the largest bank in the country. We employ 250,000 people worldwide. Most of those are in the US, and we certainly put our employee well-being at top of the list. So many of you know that in 2018, Jpmorgan Chase launched a joint venture with Amazon and Berkshire Hathaway to create a company that now has a name. It's called Haven, and its mandate is to improve the healthcare outcomes for our 1.2 combined employees and families. Now, these are still very early days, so they are working to figure out exactly what this not-for-profit company will do and how will it do it. But I can say a few things. One is that the first priority will be to address the 1.2 million employees and their families, but really to create the case for what can be done more broadly across the board. These 3 families combined have a very different employee base, and that's good because it mirrors the differences in employee base in the country as a whole. The company is headed by Atul Gawande, who many of you in the healthcare space know well. He's the CEO, and he's collecting an extraordinary group of folks who will work with resources of each of these companies to achieve best outcomes. The goal is better service, reduce waste and inefficiencies, and scale these solutions beyond these three companies as best as possible. I think the three things that I've heard Atul say are going to be top of the list to begin with are primary care, easier to access. This gets to the point of let's reduce deferred care wherever we can. That is not lead to good outcomes. Insurance benefits that are simpler and easier to use, and just improving affordability, reducing costs. But many more will come, and you'll be hearing more about that from Atul and others down the road. One of the things that I'm personally particularly excited about with this initiative is that their mandate is to leverage the power of data and technology to drive better incentives, a better patient experience, and just a better system overall. And of course, that's where the Institute and this come together very tightly. All our work is very data-driven. Let me say beyond the employees, because I think the report does a terrific job of saying it's not going to be enough if companies focus only on their employees, although I do think it's absolutely necessary that companies do that. The Jpmorgan Chase also cares enormously about its impact on customers and the communities in which it serves. And you pointed out, Bryan, in your comments that more and more companies are being asked to step into the void of addressing a lot of these social issues. As you will see in Jamie Dimon, our CEO's annual shareholder letter, he's stepping right in, and the whole bank is stepping right in. And so even yesterday, 2 days ago, we announced an expansion of the work and the commitment to Detroit and development in Detroit, which goes well beyond financial products and services to a partnership with the mayor and with others on the ground to really help Detroit make a full comeback after what's been a very difficult decade. We have similar programs in Chicago and San Francisco that have been recently announced, and of course in DC. Many of you will now have seen that Chase is opening up branches in DC. We see this now as a critical community, and we'll invest in that and look forward to that partnership. So thank you for listening to me, and really want to thank the group here for bringing this important conversation to light. I think we have time for a few questions if people have woken up. I had questions for the Surgeon General, but yes, please.
Ms. Farrell, thank you. My name is Philip Dever-Demetri, and I'm with Chevron. I have a question for you about the Sustainable Development Goals, the SDGs that the UN put out. In what way do you think that companies like ours could use the SDGs to think holistically about this problem and seek to address them? Obviously, the SDGs talk about the importance of institutions, communities, economic development, and health. And underlying all of this seems to be a holistic approach on how to not tackle just one issue, but look at the whole landscape. If you could speak to that, I'd appreciate your perspective.
Sure, thank you. I think in some ways you answered your question. I do think the ways in which the push that many companies are taking for a more transparent and more aggressive ESG approach is the way we can include some of these conversations in it. And recently, a couple months back, Jpmorgan Chase actually issued its ESG report that highlights in particular the critical role that private companies need to play in building communities. And by building communities, we mean all of the interlocked things that, that come to bear, of which health and the well-being of people in those communities has to be on the top of the list.
Hi, I'm Dr. Thomas Perry of the Integrated Benefits Institute, a not-for-profit health and productivity research group. Many employers that have moved to the high deductible plans have also put in health savings accounts. And their argument is that they have funds for employees to get health care. Now, there is evidence to show that when employees, even with health savings accounts, don't get care when they need it. Has your research looked at the impact of HSAs on the issue of access to care and outcomes?
It's a good question. We have not specifically looked at it. We do plan to keep expanding our work in this area. So HSAs, even other forms of credit that could be linked specifically to healthcare, like rainy day funds or emergency funds, are things that we're very interested in. I mentioned that our broader research outside of the healthcare space is really focused on this volatility experience for most Americans. And I think for many people who follow low-income communities, this has been a topic of conversation for a while. Low-income communities face even higher levels of volatility than others. But what we find is that this is true for Americans across the board. So quintiles 1, 2, 3, and 4 all experience levels of volatility that by and large are higher, meaning dips in income, spikes in expenses, that are higher than the cash buffer that they have to withstand those. So HSA accounts, other things like that, actually create that buffer in effect that is reserved for healthcare, which is probably a good thing because that's probably one of the most important things on the list. I will point out another related issue where the HSAs kind of played a role. We did research on hurricanes in Houston and Miami to try to understand what the impact on families and small businesses were from those. And to our surprise and disappointment, one of the categories of spend that dropped dramatically after both of those hurricanes was healthcare spending. And you think, wait, if anything, you would have expected healthcare spending to go up as people face floods and other things. But of course, access to healthcare became even harder there. And so those issues are related in terms of access to funds and access to providers as well. Yes, please.
Jerome Adams, Surgeon General.
We know.
I love that Amazon, Jpmorgan, and Berkshire Hathaway are really leaning into this issue. We've worked with other large companies because we know that they can drive a national narrative. My question for you is, in a world where 50% of the businesses out there employ 50 or less people, what do you say to middle and small-sized businesses when they throw their hands up and say, well, that's all well and good for JPMorgan Chase, but I can't do this in my small community. I don't have the influence, the resources, the talent, the treasure, and the time to actually lean into some of these complex issues.
Also, thank you for raising that. One of the big bodies of research that we do as the Institute is on small business well-being and finance. Most of you know that the information in that sector is very sparse. It's very hard to survey those businesses. It's very expensive to survey them, and as a result, we have very poor data. We have very large small business customer base, so we can document them. And what you say is exactly right. We actually did a study on the healthcare premium burden on small businesses, and it's very high and it's growing. And so the complaints are very real. I think I would say two things to that group, that no single small business is going to solve this on their own. And so the coalitions that have been forming to bring groups of people together to engage with policymakers at the state, local, and even federal level, I think are important. But in the case of Haven, the venture between Amazon, Berkshire Hathaway, and JPMorgan Chase, one of the things I mentioned is we have very different employer base, but very different constructs too. So your comment is exactly right about Amazon and JPMorgan Chase. They're not only very large companies, but they have a particular, they're primarily urban, for example. They're primarily concentrated in certain demographic groups. But that's not true for Berkshire Hathaway. Berkshire Hathaway, as many of you know, is a portfolio of companies, very small, very large. Now, they do have the backing of this great investor, but I think that's a window into how different the challenges are depending on how groups of people come together, and we hope that'll be a meaningful step forward. Other questions? Great. Well, thank you for your time again.
Thank you, Deanna, for your terrific insights, and we look forward to working with you moving forward. Great that you're here with us today. I think we're going to transition to our panel now, so if I can ask our distinguished panelists to please join us on stage. They'll be introduced by the moderator of the panel, Ms. Chrissy Giuliano. Chrissy is the executive director of the Big Cities Health Coalition, which brings together the leaders of America's largest metropolitan health departments collectively serving 62 million people in their communities. Chrissy has 15 years of public health experience, including at Trust for America's Health, the FDA Center for Tobacco Products, and at Resolve. Chrissy, thank you. I'll let you take it away.
Thank you so much. We have a fabulous panel here. I'm going to try and do brief introductions and then really have them tell you about what's going on in the community. So I will start and just go down the row here. Dr. Rex Archer serves as the Director of Health in Kansas City, Missouri, where he's responsible for safeguarding the public health of nearly 500,000 residents, including a daytime population of almost 1 million people. He's also a member of the Big Cities Health Coalition. He serves on the board of directors for the Public Health Accreditation Board and is a past president of NACCHO. He's served on numerous national committees in public health and is really, in my experience, a passionate spokesperson for the field and his department's work. Carolyn Crawley, you're on my next page, sorry. Cawley, president of the U.S. Chamber of Commerce Foundation and a senior vice president at the Chamber, which is the world's largest business federation representing more than 3 million member companies. The foundation is the nonprofit affiliate of the Chamber, and there Carolyn oversees the Center for Education and Workforce, the Corporate Citizenship Center, and the foundation's Emerging Issues portfolio. Mayor Bill Purcell, the 5th mayor of the Metropolitan Government of Nashville and Davidson County. He was first elected in 1999, re-elected to a second term in 2003. During his 8-year tenure, the city saw unprecedented economic expansion, an increase in school funding, and the development and preservation of more than 26,000 affordable housing units, all important social determinants of health, I might add. He also served 5 terms in the Tennessee House of Representatives. And finally, Mayor Betsy Price, the mayor of Fort Worth, also a Fort Worth native. She was elected in 2011, re-elected in 2017 for her 4th 2-year term. Fort Worth is one of the largest growing cities in the country. It recently moved up to number 13. I got that in an email from her health director, Tarrant County, telling me we're bigger than so many other cities in the coalition now. Mayor Price has focused on jobs, education, fighting crime, and improving mobility. And she's also made strides in building a vision for a healthy community. So thank you all for being here. I hope I didn't leave out any important details in trying to be brief. So I think what we want to do is start from hearing a little bit from each of you about connecting business and public health to improve health in your communities. So I'm going to give each of you just a few minutes to talk a little bit about that, and then we'll move on from there. So, Dr. Archer.
Well, good morning, and it's really interesting having 480,000 patients, whether they know you're their doctor or not. But it's more than that, because we're part of a 2.2 million metro area, and I've never been able to get communicable diseases to stop at the county or city line, but also the social diseases, the social determinants of health also cross over. So when we work with our chamber to raise Tobacco 21, if we just did it in our city, they could just step across the jurisdictional line. So we had to work with the Greater Kansas City Chamber to do this across the entire metro area. Now, we've had words like catalyst, partnership. I'm talking about power and relationships. We're blessed with a very civic-minded business community in Kansas City. So when I do a one-to-one with business leaders, our values start lining up pretty quickly. And it's not just the bottom line. And we've talked about competitive disadvantage that we're actually having in this country compared to a global market now for businesses. And when other countries produce less disease and injury than we do, and spend less on illness care than we do, that's a disadvantage. But actually, we're seeing now that productivity and absenteeism because of illness is probably 3 times as expensive for businesses as those other factors. And when our chamber comes forward and says, rather than building jails based on 3rd grade reading level, why don't we fix the 3rd grade reading level by sponsoring a tax increase? Now, chambers may not always be about regulation and increasing taxes, but when you do the value proposition, they get behind these issues, and we try to get educational quality pre-K for the families that can't afford it, because If their adverse childhood experiences are high, then they're twice as likely to be absent at work as adults, and they're less productive. So that partnership has been really critical. The other part, and I think Surgeon General and others have kind of mentioned this, you may have a small section of the business community that is against a particular issue. You've got to get the rest of the business community to understand that rather than subsidizing them out of their pocket, that they need to stand up against that. Or at most, or sometimes at least, we end up getting them to be neutral. So when we raised living wage in Kansas City and in the state of Missouri, we were able to get the business community by and large to stay neutral, and that was enough to be able to get it to pass. So sometimes neutrality is a good partnership.
Carolyn?
That's great. Well, thank you for having me here today. As you mentioned, I run the Chamber of Commerce Foundation, which is the nonprofit education affiliate within the larger chamber. And our mission is to educate the public by bringing together stakeholders about what business needs to do well and do good and prepare for the future. And this is a great topic. I think all three of those things come together around community health. And while we spend a lot of time talking about the conditions required for business to thrive and for communities to thrive, you would most often expect those messages from the chamber to be about lower taxes and a more sensible regulation regime, but increasingly it's about having healthy, productive employees, as the Surgeon General mentioned, because there is one thing we hear from our members every single day, which is that they cannot hire enough workers or the right workers. And so we've got this terrible gap between people without jobs and jobs without people. And the health and social determinants are a big part of that. So we've seen a big uptick over the last 6 years or so, a really interesting evolution, which I know we'll talk about, that we hear about from our members and what they're interested in doing in those communities. One of the things that the foundation and the chamber can really bring to this discussion and to the activities that we do is our footprint of about 2,000 local and state chambers and associations around the country. So by partnering with people, we're not the subject matter experts, but we're really good at getting the business community together. So when we partner, those state and local chambers help us get, real local real fast. And that is really important because we can't fly in from Washington or from the coast, as Deanna mentioned, but we need to partner. Every community is different. The context, the healthcare determinants in each place, education levels, access to healthcare is different. So by partnering with the businesses in that community, we've been really successful in educating them and giving them the tools. The last thing I'll say is that I think the role that the foundation can play here is making lessons and tools more accessible and more translatable for small and medium-sized businesses. We represent a couple of million small businesses, and the other thing we hear from them, besides not being able to hire, is how hard it is when they're strapped for time and resources to find the things that are immediately operational and implementable for them as a small business. So it's a great conversation to have, and I'm so pleased to be hearing so much about small businesses in particular today. So thank you.
Well, I join every other member of the panel and everyone here, I think, in thanking the Bipartisan Policy Center for convening us, for a report that gets it right, I think, in every respect. Surgeon General, who has given us a charge, both from the center of American government here in Washington, but also in places like Nashville and across the whole country. And the data from Jpmorgan Chase and the things you're going to be looking at give us hope. But I'm especially pleased to be a part of this panel. The U.S. Chamber of Commerce has led on business engagement in this issue uniquely, I think. Kansas City, I was there a few weeks ago to talk to their civic council, and it is a business community that understands these things. And my grandfather, having been married and had my mother, or my grandmother actually had my mother in Fort Worth in 1926. I've always thought of Fort Worth as a very forward-looking city, and I hope that I'm some living proof of this. I know that Mayor Price is. In Nashville, Tennessee, a new mayor in 2002 decided that we should be a healthier city. We had a declaration that we would be healthy as a city in 2010. My goal was to be the healthiest city in America. The mayor started building sidewalks. The mayor started focusing on greenways and bikeways and public spaces and taking walks, and the walks got longer and longer, and people were encouraged to be a part of that, and that was all good and right and appropriate. But 10 years later, it was very clear that the mayor alone could not do it. Mayors change, but more importantly, the government alone couldn't do it at the local or, as the Surgeon General said, at the national level either. It was going to require more, and so uniquely then, with the encouragement of our U.S. chamber, our local chamber decided we need to know better about how this affects us and what it means. They hired FTI and the Center for Healthcare Economics and Policy and brought them in to help us look in a very specific way about what these issues meant for Nashville from a business perspective, and how we compared, not just to ourselves, which is typical, year over year over year, but how did we compare to the cities that we compete with, the cities that we compete with for other purposes, that bucket of cities that we look at every day to say, why would a headquarters go there instead of here? Why would jobs go there instead of here? How are we doing compared to them? And no surprise, we were better than we knew in some places, but not as good as we hoped in lots of others. 2 years later, the chamber came back and said, we need to know something more. What does this mean financially? Not just in terms of premiums, we've known about that, not just in terms of healthcare costs, but broadly, what does it cost the economy in this city every year? And the numbers suddenly were stunning. The chamber itself said, it's more than $500 million a year just for hypertension, diabetes, and obesity. When we add COPD and asthma and depression, it's $1.6 billion a year for the city of Nashville. It's expensive, it costs us, and it goes directly to the prosperity that we want, and it also affects our ability, as has been said here in every way by every speaker, and I know Fort Worth, I believe, will be the same. It affects our ability to recruit and hold the very people that we want. These are issues that go to the bottom line for families and for cities and for business, and the outcomes as a result quickly, and I know we'll have a chance to come back to some of these things, are that Healthy Nashville, which began all those years ago, continues, led by our public health department, but Nashville Health, which Bill Frist from BPC, our former majority leader and a great Nashville resident, Caroline Young and others from her team are here today, have continued as outcomes of this basic research to say, we've got to work together. It's got to be this set of partnerships. Business has to be at the table. Business is going to be there for the long term to keep these things going. And those outcomes give me hope that while it didn't happen in 2010 in Nashville, it will happen in Nashville, and because of what we see happening in other places from Buffalo to California, that there will be, in fact, greater health across America because of this basic notion of working together and business being in the room.
And thank you all, and thank you to this esteemed panel and to the Surgeon General who's been in Fort Worth a couple of times with us. I'm going to talk a little bit, I should say howdy from Fort Worth. Texas is, as you all know, the land of pickups, suburbans, steaks, barbecue, and Mexican food. Not exactly the healthiest community that you would expect. And when I was elected in 2012 and we began talking about community health, one of the reasons we did is because Fort Worth needed a tool in our toolbox as we looked at economic development that would really distinguish us, beside the fact that we have great barbecue and Mexican food, something that would distinguish us for employers working, something that would draw families in, that would attract college students to stay at TCU or Wesleyan to contribute to our community. And one of the ways to do that was to look at the community health. It's not only the right thing to do, but economically, it's the right thing to do to drive businesses. For the city's part, we looked at what could we do and where was the city. Fort Worth's a very conservative city, and people like smaller, less government, not so much interference with our business community. To drive health policies was never going to come just from my office or just from council. It had to be a partnership, and we had to find something that we could get everyone to buy in. And I thought I'd talk to you a little bit about what we did and why we did it. We started initially when I was elected with Fit Worth. For one thing, I like to be out and about in the community, and so one thing we did was I started doing rolling town halls on my bicycle. I happen to be a cyclist. And we would go to different neighborhoods every week and ride and invite people to ride with us. And Saturday mornings we did walking town halls. And it was amazing what people would tell you. We'd get out and do more of this, Mayor, if we had better streetlights. We'd do more, Mayor, if we had better sidewalks. If my neighborhood had more small clinics and grocery stores, we'd be more. So we really started looking, what can we do for the health of our community? We met with our chamber president, who is a friend of mine, and he said, I'm with you. The chamber has to buy in and look at health more than just fitness programs at our local businesses. So then we met with our school leaders and said, let's talk about school health, because healthy children learn better. And we all know that we're facing an education crisis in this country, particularly with our young ones and where they're going, and high incidence of children's diabetes and obesity, which keeps them out of school, which in turn is cyclic on their education. So we also met with Texas Health Resources, which is the largest healthcare provider, and they in turn were looking at hospital care. How can we get to where we're preventive and not fix it once it's broke, in just layman's term? So all of us came together and started looking at the blue zones, and most of you are familiar with the blue zones. It's Dan Buettner's research on healthy communities where people live the longest, but not live in nursing homes, but where they contribute the most to their community, where their quality of life is better, and how do we offer simple nudges to make that work? The three business, chamber of commerce, the healthcare communities, and the city came together to look at who could take what policies and how would we do that. We set out on a 5-year journey. We had started a small group called Fit Worth early on our own at the city, and Fit Worth was partnered with our schools. And I'm proud to say in 5 years, Fit Worth in the corporate challenge and the school challenges was able to reduce childhood obesity 6%. In a school district that's 87,000 kids, that's a lot of kids when you think about a 6% reduction. So building on that, we brought Blue Zones in with a 5-year plan, funded initially by a grant from Blue Cross Blue Shield and a follow-up grant from several of our philanthropic groups and our Chamber of Commerce and Texas Health Resources. And my office led the policy changes. And we've been able in 5 years to move Fort Worth. The first benchmark is to measure the Gallup Wellbeing Poll, which has been done for 15 or 20 years at the top 190 cities in the nation. And unfortunately, my Chamber of Commerce president said, don't you dare share this, Mayor, but I will. The first time we really took a hard look at our well-being poll, of the 190 cities, Fort Worth was number 185. Mm-hmm. And it's frightening when you start. That's why he didn't want that out. He didn't want businesses to know it. So we started working on it. In 5 years, we have moved from 185 to number 31 on the Gallup Wellbeing Poll. Astounding. We also have had a 31% decrease in smoking in the community, driven by grassroots movement, driven by policies. And our biggest changes have come in our minority and lower income areas, in the zip codes where we had by far the most risk, families at risk. So it's been really exciting, but the good news has been not just the city and the policies. We're the built environment. We're the policies. The businesses got engaged and started forming smaller groups and talking about how could they really do this. Our schools got engaged. We now have 31 schools that are Blue Zone certified. Our PTAs got engaged, and the first Blue Zones community in the nation to engage our faith-based community. We got 32 churches to commit. And one of our largest churches, I was visiting with the pastor, and he said, you know, we work on people's spiritual health. We ought to be working on their physical health too, because God gives you a temple to live in. And he said, I never had thought about it. And they now have several thousand members engaged in it. But it has really taken, this paper was particularly enlightening because so much of what's laid out at this paper is what we've done in Fort Worth. We brought everybody together. It wasn't easy. I locked the business leaders in the room one day after they kept saying, you can't do this, and literally said, nobody leaves this room until you make a commitment to do it. Including Jpmorgan and Lockheed and Bell, and then several hundred small businesses to get on board. And now I had one of my largest naysayers the other day say, Mayor, I'm hearing incredible stories from my employees about the changes in their personal health and the commitment to their own families because their kids are bringing it home, their pastor's hitting it home, their employer's hitting it home. That's how we've been able to move from 185 to 31.
Chrissy, can I take a Surgeon General's prerogative here? I just want to ask Mayor Betsy a really
I don't think I can say no to you.
Mayor Betsy, you mentioned something that I think was critically important to this
They're bringing you a mic.
and that Mayor Betsy, you mentioned something that I think was critically important to this conversation, and that was that you specifically tackled health equity. I've been there, and you went to the communities that were most affected.
Yes.
Far too often, we pat ourselves on the back for a new housing complex that causes gentrification, or a shiny new park in a community that makes us look good and feel better, but that really increases disparities. I'd love to quickly hear from you and from the other folks on the panel how you wrap health equity into the conversation that we're having today, and not just let everything we're talking about be an opportunity to lift up the people who are already floating at the top and push down the people who are at the bottom.
Health equity has to play a huge piece in it because if you're going to get your community with everyone working, if you're going to get everyone well educated so that your future workforce is there, you have to start with those who are below the norm, who are below the poverty level. That's where the greatest challenges are, but that's where the quickest wins are. We were shocked when we realized in those communities, people said, our street lights have been out for 3 years. Why don't you fix them? They didn't know that they had to log on the website. In a city of 900,000, we don't have a patrol that looks at every street light you can imagine. And Fort Worth is spread out over 352 square miles. We're a huge geographic city. But people have to report. So the simple things, go to the community centers, tell us where your sidewalks are broken. Go to the web, tell us where your street lights are out. Put more of our NPOs, which are our neighborhood police officers, put basketballs in their hands, baseballs in their hands, get them in the parks. Open the schools. We don't run the schools, the independent school district does. Go to the superintendent and say, will you open your playground to the kids to get out afterwards? And remember, kids spend very little time actually in a classroom. The bulk of their time, they're on our street, in our community centers, and ultimately, if they're not working on positive things, they're in our jails. So to connect our after-school programs and our before programs became critical to the success. And we knew if we broke the city into 5 quadrants or 5 areas, zones, if we start in the low equity areas first, we'd have the biggest gains. And we had much bigger gains than we ever expected. I expected our gains to be in the TCU area, which is a very successful university area where people tend to gravitate. Surprisingly, the gains were good there, but the excitement and the sustainability in the last 5 years has really come in our other zip codes.
Should the rest of you want to comment on the equity question? The Surgeon General.
Yes. So with Tobacco 21, when we were considering it, there was the opportunities of, in a sense, punishing businesses that were selling to under 21. But you could also make it illegal for possession under 21. We chose to not do that because of the challenge that you have often with racial profiling and other things to where that might not be the right way to go. Plus, technically, they could have bought it outside of the city. So that was a specific issue that we looked at that. Educational quality pre-K, there's no question that it can help a lot of folks because it'll help a classroom where half the kids aren't ready to learn, then the other kids aren't moving forward at the same rate. But specifically, in our low life expectancy zip codes, there were even a higher percentage of folks that could not afford educational quality pre-K. So it's a both and, but always looking at making sure that we're not disadvantaging folks and maybe actually helping with a little bit more advantage.
Thanks.
It is, as this report indicates, as the Surgeon General said, our duty and I think our continuing challenge to make sure that when we are talking about health, we're talking about community health and saying it is our community's health. We all own it. the days when we could say the public health department is responsible for all those problems out there in the field, especially in those areas where I don't feel safe or I'm not going. But in fact, it is everyone's obligation that the whole city is safe, that the whole city has well-being and health, and every employer, and that's where I think this business collaboration is so critical, because it's an understanding that community health means the health and well-being of all of us, and not just morally, but economically, it is absolutely in the interests of all. If the whole community is perceived as a healthy place with opportunities, then people will want to come and will want to stay. But to be a good place to have a heart attack if you can afford to pay for it, well, that's something I knew, and that's an encouragement. But what you want to be is a really excellent place not to have a heart attack, not to have those healthcare outcomes anywhere in your community or reduced to the lowest possible level because of action that we've taken together. It's going to be good not just for your spiritual health and the temple that we've been given, but ultimately for our economic well-being for the future. And that's the message that's got to move.
Stealing that quote from you, Mayor. I like that. Don't just be a good place to have a heart attack. Be a good place to not have a heart attack.
And I think one other thing we had to look at, and everyone does, is getting the buy-in from your medical community. I visited with one of our largest groups from the AMA early on and said, look, you guys are caring through our county hospital for the least beneficial families, the families who have the least. What do you tell them about their children's obesity? They said, we rarely talk to them about their kids' obesity because most of them are obese in their own right and they don't want to hear about it. And I said, we would like for you to change that mindset. And they've begun to ask them, what do you eat as a whole? How do you set an example for your children? And one of them told me just the other day, said, I've got young mothers coming in now who are pregnant saying, you talk to my sister about her health, tell me how I ought to raise a healthy baby. Not from the vaccinations, not from the checkups, but rather from the side of what do we eat and how much exercise do we need. A little incremental change can change a community.
I think from the foundation's perspective, if we were to hold up a mirror to that question, our programming has gone in this kind of backwards pipeline. When we started this 20 years ago, it was all about, even then, skills of the future, jobs of the future, the skills gap. And then it quickly became a conversation about post-secondary education, and then that became about K through 12 education reform and accountability, getting to the equity question. And now the demand signals we're getting more and more from our companies is early childhood. Yeah. And so one of the fastest growing areas of programming at the foundation is going out and talking to chambers and doing briefings about what early childhood education looks like, what good looks like in a community. And so it's become much more of a pipeline all the way through a child's life, not just when they're graduated and looking for jobs.
The Chamber has a great Cradle to Career initiative that y'all have focused on that we're a partner of, and I love that initiative.
Yeah, and I just wanted to clarify that we have not actually funded the educational quality pre-K. We did take it to the voters. We didn't succeed this time, but we'll be back. And so even with the Chamber's full support, it wasn't quite enough to get there this time. But that's part of relationships and perseverance.
So I want to combine a couple key concepts that some of you have touched on in your opening remarks and sort of ask you to talk about the ones maybe you touched less on. So the paper talks about this value proposition of partnerships and the value of working across sectors for a community's health. You all have talked a little bit about community health and health care. So I'd also like to talk about the community health piece, sort of absent from the care piece. So if you could, we'll sort of go down the line, talk about the value of that partnership, of those partnerships across the sectors, why good health is good business, and what that real community health piece means, big picture. That would be great.
Well, we know that we've not been successful in this country or in our city of treating our way out of these problems. When we're creating more illness and injury than other countries, other states, other cities, we have to get further upstream in prevention. So tobacco was a clear one. increasing the living wage. We know now that for every dollar you increase living wage, you reduce suicides by 2%. Those are huge changes because for every suicide, there's a lot of other attempts and people that are not productive because of the stress that they're under. So yeah, I think we're all waking up to the fact that we're a product of our community. I mean, how many public buildings do you go into and the elevators are real easy to find, but you can't find the stairs? Or the stairs may not even be safe to be walking on. So yeah, all these changes are critical within a community. Now, the neat thing is that there's 100 things you can improve. So you just kind of sense, well, where's the motion, where's the movement, who else is willing to make stone soup, if you know that story, where you just start adding things to it and start building. And the other thing is we're learning a lot about, in coalition building, don't focus just on one issue and think, well, you either succeed or not, and then everybody goes back to what they did before. Build on the concept that we're in this for the long haul, and even if your issue is number 7, 8, 10, 11 on that priority list, the way we get to your issue is we take number 1 and 2 and 3 off, and we get down there and we stay together and we keep building and working together.
So Carolyn, from your members' perspective, what's the value proposition for partnering in the community?
Well, one of the most interesting things I think about our work at the Chamber is that we're not, as an organization to begin with, we're not sector specific. So definitely we start from a cross-industry, cross-stakeholder partnership. So the problems that we hear from our members and the challenges that they're facing are not specific to industry, and they're not even specific to size of employer. We work, big companies, medium and small, are employing people and taking care of families and experiencing a lot of those same problems. What we're seeing is a greater consciousness, as everyone here has been talking about, outside of your your basic physical readings that you go to a physician about, that we're getting increasing requests about mental health training in the workplace. We're seeing, and we're doing partnerships on that. We're seeing a lot of requests from small businesses in particular, some medium-sized as well, about how to manage substance abuse, prescription drug abuse in the workplace. It's an epidemic that we read about every day. Big companies have the back office resources to launch big programs and lots of employee assistance. The smaller companies, not so much. And so, when you are the founder and the owner and you're also the attorney and the bookkeeper, you don't have a lot of time to go become an expert on prescription drug abuse. And I think someone mentioned earlier that, the problem is not the volume of resources, it's how accessible they are. They're so spread out. Millions of employer resources. So we try to go talk to different groups, different businesses, and bring that all together into one hub. And the third area, and I think this is another thing that Deanna mentioned, is employee assistance funds is another area that our members are asking us about a lot when families have these upticks and extraordinary events. And so we can bring together companies from across sectors to talk about not oil and gas or not retail, but how they're putting together EAFs for their people. So we're just seeing a lot more of a common problem that's not specific to any one kind of business.
Great.
Well, I talked a little about the realization early on that you couldn't do it alone. If you could have done it alone, it would have been done long ago. But the notion of who needed to be together and for how long was not clear. And I think now the understanding is it is all of us. And a big piece of us are the places we work and the people we work with. And it's forever. It took half a century or more of policy and practice for us to move from a place where everybody knew they were going to live longer than their parents to a place where that was no longer true, where obesity suddenly began eating up 20% maybe of all of our healthcare spend just for one condition. It took a long time to get there, and it's going to take a while to get out, but it ultimately is going to be forever. And except in Fort Worth, mayors do come and mayors go.
They will come and go there too.
And leaders can change. And if we're going to be in this for the long haul and sustain this forever, as I think our Surgeon General wants us to, and we do too, then it's going to take those folks who are there for that long haul as well. And the business community clearly understands that they have a sustained, literally forever, need, and that means, I think, that they get the fact that we're now there together forever.
Yeah, I think that's exactly right, Mayor, that it's the business community, the health community, the schools, the churches have all come together and are beginning to speak the same language. While one's talking just about care and one's talking about our workforce, suddenly they're looking at each other going, you're as impactful on the workforce as I am, and how do we change that? And for us as city leaders, one of the things is how do we become attractive to the community? The millennial generation, and I've raised a millennial. I have 3 kids, and the youngest one's a millennial. He was a late trainer, shall we say. It's a blessing on the end. But they're different. They think different. They look at cities different. They look at, do you have great parks? Do you have great outdoor space? Do you have worker space? Is there a co-op of medical care? Is there great early education in your community? And for us to continue to grow and succeed as a city, and for Nashville to continue, all of us, we have to be looking at every proposition. The other piece is, at the far end of all of us baby boomers, we don't want to just go away. We've got a lot of knowledge to contribute. Where are we going to be plugged into that? And how are we going to still be healthy enough to get up every day and contribute? And I think that's the value proposition of bringing everybody together, is getting each end of that spectrum to look and say, you're touching me and I'm touching you, and how can we sustain this effort so that it just grows on its own?
So I want to follow up a little bit on, one of you mentioned leadership, and I think this is something that I struggle with in my day job and even in all of my jobs in public health. There's so much good work, whether it's health, public sector, wherever, that happens because of leadership or a good leader. And so I wonder if you all have ideas on how we make sure that this good work that we all want to push forward isn't just because of the leader, because leaders come and go. So how do we start to systematize or operationalize that? And how do we build this broader constituency for healthy communities, which you all get, but what if the next person doesn't?
Well, the public health department in your community, whether it's doing it fully or not, or funded to do it, should be the chief health strategist and catalyst for that community. Now that's not just the director or the key staff, and there are a lot of other partners that need to be part of that. But yes, if you're not developing the next generation of leaders, then yeah, you're just kind of a flash in the pan, and it's not going to continue. Most of us know that real leadership means that most of the time, actually, you're not in front. You've got somebody else that's experiencing that and leading on that issue. With our Tobacco 21, wasn't the health department. We didn't have to put any political clout into it at all. The chamber ran with it. They had 161 organizations signed up in writing when the council passed the ordinance that were already supportive of that. So leadership is mutual, and it's moving back and forth, and it's listening to others and finding out who the next leader is. When you hear the individual stories of the people that are harmed because of predatory lending in your community or other issues, they become leaders and you bring them forward. The city council and the mayor love to do the right thing, but it's even better when the community's behind them and helping them to do that.
Great. I think it's really important, and this is something that Dr. Adams mentioned earlier when you said you like to talk to the foundation president, but you really want to talk to the COO. I think one of the strongest ways to deploy that kind of leadership thinking is to break out of those silos within a company. So it's not just HR that needs to worry about providing mental health training, and it's not just the CSR person who, worries about supporting a community health clinic financially. And we're seeing companies do more and more of this, is when we bake this kind of thinking into manager training, into performance reviews, into staff trainings, and making it a part of the everyday business of every unit, of every team, so that it's not, again, it's not just an HR thing, or it's not just an operations thing, but when it's spread out into the responsibility and the job of people across the company. We're seeing more of that. And the other point I would make is that we need to not only show off the best practices in an academic way, but we need to help people doing good kind of get famous for that. Award them, highlight them, make sure that their experiences and frankly the challenges that they faced internally, how did they get past gatekeepers? How did they get that budget requisition? Those kinds of real implementable questions, how can we spread that out to others? So I think the awards and the recognition play a really big role.
Thanks. Mayors, like Surgeons General, can be great conveners. Mayors, I'm not sure about Surgeons General, can lock the door. I thought perhaps not, being a doctor, perhaps not, but a mayor can, but eventually you have to unlock it. Eventually they get to go back out in the community. And when they're back out there, this notion of collaboration, which appeals to all of us so much, you'll remember there's a second definition of collaboration, which is giving aid and comfort to the enemy. Collaboration is one commitment that we make, and then we get out and we're not sure anymore that actually it's in our best interest to be together with everybody else, and we go back. So first, and I think the points that have been made are clear, it has to be that understanding that this is good for everybody, it's good for all of us, it's good for me, it's good for us. That's where business can move fast and stay together. But then I think, and this is the bigger challenge, I believe, is that in the community, there on the streets, in the homes of the whole city, back to that equity issue, there has to be a sense of, it's important to me too, it matters to me, I can have that too, it's part of what ought to be my being a citizen in this place. When that demand is there, first in the business community broadly, and then frankly by everybody in the place, then the leaders can come and the leaders can go. But the leaders that don't pay attention to the demand from the business and the larger community won't be leaders very long. But those that do listen, I think, will be there to make sure that this is a transformative effect for the long term.
Mayor Purcell's right. You have to bake this into everything you touch, and you have to have not just the businesses. The businesses are the critical piece for starting this, but you got to have the schools. You got to have the churches. You got to have everyone everywhere, and you've got to memorialize it. Most mayors and chambers presidents are very proud of their initiatives and want to see it survive, but you have to think about not pride in ownership, but success for your community as a whole, because really it's got to be sustainable, it's got to be a grassroots effort. It's just like your question about sustainability. And then we get into better building challenge and recycling and all. How are we going to do that? We're never going to do it until we engage the younger generation from the grassroots up. And that's the only way we will ever change community health, is a pressure from the top and from the bottom, where people go, we're making some progress here and we're all getting better. And let's work on the schools, let's work on the churches, let's work on the businesses, because that's where people live. That's where everyone is at some point, touched by that level. I think that's how you memorialize it. You get out and you're loud and proud and make a statement, and they catch it. Passion is catching.
So I want to ask.
I'm going to just jump in, because the great thing about a great panel is it gets you thinking about some things that you should have said. And one of the ways that you maintain things is you put things down so that they have to continue. And so we have national public health accreditation standards that require those that become accredited, whether they're state or local health departments or Army bases or even foreign nations that are starting to look at this system, to do this type of thing in this type of way, in this type of process. And so when you're going through that, and about 2/3 of the country now are actually covered under either state or local or both accredited health departments. And Those standards require this type of work. So the next leader, if they're going to maintain an accredited agency, has to do this kind of work.
So I want to ask a really quick question before I open it up to the audience. We're probably running long. So if you could answer really briefly, what tools are needed or what tools do you use to help replicate good work in your communities? I know that's a big question, but if you could be quick, then we'll let others answer. But I do want to make sure we touch on that.
Relationships, relationships, relationships.
Okay.
Peer networks.
Data.
Data and consistent messaging and collaboration.
You all did that much better than the presidential candidates did last night. I had that in my pocket. I was hoping it worked. Okay, so I think we have some time for questions, and there are folks with microphones, so if you could, there's some folks over here. You want to come to the side of the room? Oh, go ahead. And if you could give your name and where you're from.
Sure, thank you. Christina Scarpasian with Weber Shandwick. I have a question. I've heard the panel and others who've spoken talk about Tobacco 21 measures, and I'm curious specifically where the panel sees the greatest opportunities for public-private partnerships to help address the growing trend of e-cigarette and tobacco use among youth.
Well, in Kansas City, when we dealt with Tobacco 21, we also included e-cigarettes in regards to revising our ordinances of not allowing those in public places. Yes, and if you're familiar with San Francisco, they often lead on important policy issues, and we're going to be looking at that very closely.
And in Fort Worth, we just recently banned e-cigarettes as part of our no smoking in restaurants and parks and things. But we couldn't have done it. We can't do things in Fort Worth without a grassroots movement. Or at least council is conservative enough, they're not going to answer generally just to a very small group of people saying, we want you to ban e-cigarettes. So we worked with our community health providers and our THR, our healthcare, to get people to weigh in, to contact their council members, to contact the mayor, not just once, but multiple times. They brought in the Cooper Clinic. They brought in a lot of experts, and when the groundswell came, then council had the courage behind them to make that vote that they would not have made otherwise. I can tell you from having worked with them for 8.5 years, they would not have made it had it not come from a grassroots groundswell.
Do Beaumont helped Nashville Health? Caroline Young is here again, and someone you should find. Not only survey and look about this issue, but then move on policy. I think, again, understanding where your community is and where the business community is and sharing that broadly, especially so office holders understand where the public interest may be, will be terribly helpful. But both Bryan and Caroline are two resources you could talk to today.
I think there's another question in the back, and we'll come up.
Hi, my name is Caroline, and I come all the way from Boston. And every morning that I wake up, I say, thank you, Lord, for these people, B, C, who have been able to make me a person that come in once a month into Washington to see all the craziness that is here in comparison with Boston. But my listing is so big that it will take a month for every one of you to try to figure out what the story is. I am a licensed bilingual social worker. I have worked 30 years of my life. And I would like to know how you guys are able to use seniors or people who are retirees more into the communities if you are missing a lot of people who is going to charge a lot of money. Second, I would like to know that you should listen more to women. I think I'm going to make a funny remark, but people in Washington, D.C., men, excuse me, guys, they have done a lousy job. We need to have a woman president now. Not that I really care too much what they have to say, the Democrats, whatever up there. I'm going to make this very short. Thank you very much, you guys, for being here. Just try to help the people that are in the bottom part of the whole situation, because they sometimes cannot speak better English or any other language. So it's in your hands, whatever you're going to do in the future for all our community and health and in education. Thank you.
Thank you.
Very quickly, we've talked a lot about millennials and recruitment and new people entering the workforce, but one of the things that our chamber focused on very directly was the healthcare costs of those in middle and later ages. These are people who are right there, right now, trained, ready to go, and doing the job. But the cost of absenteeism and presenteeism ends up, again, being more costly to them than any other part of what they've been focused on, health premiums and the like. So I think with that data and understanding, there is a commitment that must follow, that this is about those that are already there in your workforce as well as those you want to recruit. When you have both of those, and business can help us stay focused, then there's, I think, more focus and attention to older workers.
And that's where a lot of the talent is that's brought this country up, and we can all come together and learn from each other, but not if healthcare issues are dragging one end of the spectrum down or the other.
There's some hands up here. You want to come up front here?
Hi, Lee Taylor Penn with the National Governors Association. And I know today the highlight has really been on local solutions, but would like to ask if you have any lessons learned or opportunities that you think that state leaders could make in this area. Thank you.
Well, I mentioned state level health department accreditation as an important issue, and I think we have close to 40 already of the states that have either become accredited or very close to becoming accredited, and a number of the others are in the process of getting ready. Government leadership is critical. In some cases, the local experimentation is where things happen, but then state legislatures preempt locals from actually moving forward on healthy activities. So the governor's ability to work with their legislature to allow that free experimentation and improvements to occur and spread across the state, I think is really important.
The report highlights, in fact, what Governor Haslam, our previous governor and a former leader of the governors, did in terms of his own focus on health statewide. Dr. Dreisner, then his health commissioner, was a part of this, but basically he established a nonprofit that sits outside of state government, again for continuity purposes, I think, that allows us to stay focused not just on the health issues of cities, but the equally difficult, and now perhaps in some ways more difficult because of the challenges, the economic challenges on healthcare in rural areas, and keep the focus and attention there, because I think it is an equally critical part of the problem long-term for leaders, and states have an absolute obligation and need as well.
Yeah, the states need to take the cities as learning labs and spread them out across to the smaller rural communities and areas where they probably don't have the concentration that we have to pull people together. And oftentimes that's where the population surrounding us, particularly, we're in a metroplex area that's 7 million people, and Fort Worth is 1 million almost, 900 and something thousand. But those folks are coming in from rural areas around us, working with us, and the governor ought to be shining the spotlight on the successful programs that work and duplicate those across their state.
I just want to see if there's any questions over here, because I've been looking this way. But if not, I'll go back that way. Okay. Go ahead.
This young man on the front's had his up from the start.
Hello, Oscar Allen from NACCHO, and not to start a gender war, generational war, please do not forget the unforgotten Generation X. People seem to forget about us oftentimes. My question is actually with respect to the insight that you all had provided, and a couple of folks mentioned data. How can we, or what are the new techniques that you can find through this melding of business with the governmental public health or the governmental agencies to get better indicators, especially as it pertains to the economic impacts on health, either what can be future casted or properly accounted for? I ask because when you go to a business and you say, well, X amount of work can be done for this intervention strategy and embracing health, they want to be able to quantify that. And the indicators that we have, years of life lost, aren't necessarily cutting it, nor are they granular enough. And of course, the business organizations are able to provide some degree of economic assessments, but not necessarily mapped to health. So is there anything that you are thinking that you have seen successful, or even changing the dynamics as far as how we can better quantify these health impacts from an economic standpoint to better leverage the conversation?
Who wants to start?
Well, Oscar, thank you for your question. NACCHO is an important organization and is helping raise these issues for all local health departments also. It's actually interesting that when you look at businesses right now, our chamber talks about and has great slides on data and impacts either nationally or sometimes locally of these measures and what it matters. Those companies that are on the stock exchange, et cetera, that are meeting higher levels of health well-being for their employees are increasing compared to their competitors. So there's enough data out there actually, I think right now. General Powell used to say that there's the probability 40-70 rule. If you make a decision before you're 40% certain, that's probably a little too early. But if you wait till you're 70%, you've lost your competitive advantage or you're gonna be behind. So I think we actually already have enough data to most companies that are smart that will move are already moving.
There's a lot of data, but I don't think actually that most of us have it, and I don't think that we have it in a way that makes the case for us. If you look at Medicare data, very important, very complete, very good data profile, very important now that I'm on Medicare. I feel that's very important data, but that's not by and large the workforce. The private claims data is not accumulated across all sectors. It is not reported in a way that you can utilize. One of the things that Nashville found actually was that while there was big data that moves you to better health, all known, and the importance of what happens in a successful company like Jpmorgan that brings it, what happens in terms of smoking in Nashville, COPD in Nashville, asthma in Nashville, how do those things cost us? We didn't have that. It was not until we took the larger Truven database, brought that together with other claims data, crunched those numbers, applied them to Nashville, that we suddenly knew what it cost us. That's what brought the numbers to us. Mm-hmm. Has there been an update to move us as a nation? There has, but we haven't moved, not like we'd want to. It's the data that this is my community, my present, my future, that moves you the most, at least moved Nashville, I can say that, and is now, I think, moving Buffalo. And so we shall see, but it's not that we haven't had numbers, but I don't think we've had them in the right way, in a way that we can use them in the business community and in the broader community to make us change.
Yeah, the data's got to be very personal. People, we're all data's fabulous and it drives us, but we're overwhelmed with data. I mean, you can lay out and spend all day just looking at data sheets and be confused, but to break it down individually to your city, and then further than that to your neighborhood. What does the 109 zip code, the 104 zip code look like? And what have we done in those areas that has directly driven that data and changed it? And you've got to have several years to begin to look at it. And trust me, Generation X is never forgotten. They're right there on the front lines. I have 2 Generation Xers as well as a Millennial too, so we value what you do.
Data is a topic that really requires the community approach. One of the projects that we did about a year ago was going to Grand Rapids, Michigan, where there's a ton of data sets, and it's lots of people sitting on lots of data in their own way. So there was the philanthropic community that had certain sets, universities, hospitals, community health departments, and they just weren't doing a great job of pooling that and extracting those insights. And so hearing that, we went in as conveners, not as the experts on data, to pull those groups together. A large employer in the area, Amway, provided funding for them to continue to do that. So data sounds so universally the answer to everything, but it's not until it starts to be shared. The second thing I'll say, and this is more of a theory than an action we're taking right now, in other parts of our foundation, we've spent a lot of time talking to AI researchers around the country about AI for good and what are some better ways that we can make use of that. And some folks at a university in the Northeast said what I thought was the most interesting thing. They have a room full of AI PhDs and not a lot of good use cases. And I thought that was interesting. And so we're imagining ways that we could put a challenge in front of them to use AI to pool this data and what kinds of dashboards could be produced that could be predictive of declines in different parts of the community before they slide into distress. So we're not there yet, but it's just kind of a theory that new technologies can be used in new ways for community health.
So I'm a data nerd. I didn't mean my comments to be that data isn't important, because it is, but the story is even more important. And if we don't have the story, if we don't have the anecdotes and the personal aspects, people don't march on Washington, D.C. because of a Ross Perot chart. They march because of a story. And if we're not connecting personal lives to these issues, you can have all the data you want. And to be honest, even when I was at Ford Motor Company in the 80s, a lot of our decisions were not made on data. They were made on our emotions, our gut, how we were feeling about things at the time, at the Japanese quality invasion and other things that were going on. So yes, get the data when you can, but sometimes getting more data is an excuse to not doing action.
And on that note, we're going to close the panel. Thank you all. This was
Thank you.
excellent.
Thank you.
Really appreciate it.
Good job,
This
Bill.
was a great job. Thank you.
Great. I want to also add my thanks to the panel and to all of you, and in particular the mayors. I don't think we can underestimate the leadership of elected officials in catalyzing these types of relationships to improve community health. I want to thank all of you for attending today. I want to also thank and particularly recognize the staff at the Bipartisan Policy Center and the Beaumont Foundation, the team at Johns Hopkins School of Public Health, and the Robert Wood Johnson Foundation. Please share this report far and wide. Let me repeat. Please share this report far and wide. This is a tool and resource for both the public health as well as the business community. Where we go from here depends on all of us. I think, as you've heard, there's shared responsibility to achieve the vision of improved community health through multi-sectoral partnerships. So let's come up with a plan, implement the plan, and challenge ourselves that we can come back right here in a couple of years to celebrate hundreds of new collaborations across the country that are leading to measurable and impactful improvements in health. Thanks everybody for joining us. Thank you.